रूट कनाल इज द ब्रेड एंड बटर ऑफ डेंटिस्ट्री. मुझे अच्छे से रूट कनाल नहीं आती. If I learn root canal properly, I'll be able to get more patients. Root canal is the starting point of so many procedures, crowns, bridges, and so not what not. Root canal is one of the most important ways of building faith and trust. Isn't it right? But we all face this conundrum. मुझे रूट कनाल से डर लगता है. I fear root canals. कोई मिसहैप हो गया तो, इंस्ट्रूमेंट सेपरेशन हो गया तो, breakage also. You call these days a sophisticated word, breakage, or sorry, separation. Perforation हो गया तो, कोई और मिसहैप हो गया तो. What all are the answers to it? Let's find out in this video. Hi, I am Dr. Bhavdeep Ahuja. I'm a dentist with 22 plus years of practice. Along with dentistry, I teach colleagues on the topics of practice management, medical legal consent, and finances in dentistry. And I'm doing so since 2012. So in this video, I'm going to debunk a few myths about, you can say, associated with the root canal, how to inform, how to not inform, how to deal with such things. Of course, not on the domain side, but on the other sides. I came across this query in a Facebook group, which is supposedly you can say a root canal specialist group on the net. Of course, I won't be naming it, but some of the answers that I found on the same question were really appalling, were really, you can say, ununderstandable, I would say. So let me break down a few myths for you. Instrument separation or a mishap happening. Whenever you have to start a procedure, you have to start with a consent form, period. Such a situation which involves intricate, you can say, dentistry has to be started with a consent form in the start. And when you do so with the consent form, you mention all the procedural hazards in there. I'm not going to go into the details of what exactly should be the top and the bottom of the consent. Just to put it in one line, what you find on the internet or Google are the bodies of the consent form, the center of the consent form. They are not acceptable in any court of law. Some people use a blanket consent. I am authorizing Dr. So-and-so to perform this procedure, and I shall not hold them responsible for any damage that happens to my mouth. Sorry, not acceptable. So any idle consent form has to be top and bottom has to be customized for each patient. I'm not going to go into those details. Let me just stick on to the procedural part of the endo or the root canal part as I have started out in this video. So we mentioned all the hazards of a root canal. It can be perforation, it can be instrument separation, or it can be any other thing. Before the start, it is always better to be on the patient with the same page. Let the patient make an informed choice of what you will be performing in that procedure, the verbal part, and of course, followed by the written part. Now, once you do all these things conveniently, and of course, God forbid, such a thing happens, what are you supposed to do? You're supposed to inform the patient, as we informed you at the start, there is a possibility of this thing happening. And this thing is there. But that doesn't absolve you of the responsibility that you carry towards your patient. As a responsibility, you have to get the first aid done for the patient. For example, it is a separation part. You always make efforts to get it bypassed or retrieve it yourself or through a specialist or whatever way you want to. Charging or not charging is a personal issue. How you deal with that in the consent form, it depends upon that. Personally, I am against charging, but you are free to go ahead with any of the part in that regard. This is one aspect. Now, then people ask it that why should we inform it when we have done it, when we are going to retrieve it? The thing is veracity, one of the cornerstones of ethical principles, which means truth telling, has to be there. Now, understand this procedure, just the flow chart once again. You inform the patient prior to the start about all the mishaps or the hazards, procedural hazards that are possible. The patient makes a informed choice whether he or she will be willing to go in for the procedure or not. God forbid this happens, you inform it, take the first aid, retrieval, not retrieval, specialist intervention, not intervention, secondary things. But that is the flowchart. You have to go in that way. Now, let's come to a different scenario. People don't inform at the start, don't take consent forms in that sense. Then when it happens, they don't inform even then. The patient sometimes does not get the infection resolved, or maybe has a problem, or if the dentist is not available, maybe 3 years, 6 months, 3 months, 6 months down the line, and the patient goes to another colleague of ours. And what happens? The subject J and subject BB, subject jealousy and subject backbiting, take you can say, a priority in that, and the colleague goes on bashing about each one of us, whatever he has done. Of course, if he's in good faith, he'll try to underplay this thing. This is a normal mistake which happens with everyone. Many भी शायद 100 की होंगी. That is the way to underplay these things. But if you highlight it as if you are Mr. Perfect, I'm sorry, karma comes back. Always remember, karma does come back. So when, or even if that colleague is highlighting it or not highlighting it, or maybe the colleague is mentioning, when he has to start, he mentions it in his case paper or case history form, or whatever way you are recording, that this is the way, so we are doing that. Now the patient gets aggravated, patient gets anxious or angry, and that, why did my first dentist not inform it if he has done this mishap? Now the thing which you were supposed to do as a inform as a procedural hazard, as a complication of the or the side effect of the treatment, now becomes a negligence, just because of one missing thing, one missing link of not informing truthfully to the patient. There will always be people who will have a bias against what I'm saying, but I'm telling the truthful things. Having done my MLE from one of the premier law schools of India, from National Law School, Bengaluru, I can vouch for that this is the right way to go ahead in this. Now, with this little bit of knowledge, I will, of course, encourage colleagues that we need to understand that we are lacking in the DMF index of dentistry, the documentation, the management, and the finance. Fortunately for you, being a dentist, I'm offering all these three since so many years now. Now I've shifted to a platform known as PhD on the Facebook. It is how it looks like. The link is very simple, facebook.com/groups/Dr. Bhavdeep, by my name only. So the basic aim is that we are not taught about the documentation skills, the management skills, and the financial skills. So these are the loopholes, these are the gaps in dentistry. To overcome these, I have created this community online. I was doing WhatsApp education since 2016, but of course, this is my way of paying back to the society. But now I've started this community on 12th of August, 2022 only. So this goes by the name of PhD, plugging the handicaps in dentistry, plugging the handicaps of the DMF index of dentistry. So you may have excellent domain skills, but if you are not having these 3 DMF skills, you will be lacking. And I find it very pitiful that people don't learn from someone who knows these things and put up their random questions in the groups. So if this video has helped you, please do like, please do share with your colleagues who are ill-informed about all these things, and please do subscribe to my channel. I come up with a video series or an audio podcast every Wednesday and Saturday on my YouTube channel and my audio platform, which I'll be notifying very soon. So you can join me over there, so that, and do hit the bell icon so that you are informed of any future video that I upload on the same. Thank you so much. Bye-bye. Take care. Shabba khair.